Hey everyone, welcome to week 2. I hope you all had a really great first week of our spring semester. I just wanted to come on and walk you through what's expected of you this week, and I also wanted to spend a little bit of time breaking down the Conrad reading. So first off, as you can see, I'm in our Unit 1, which you can find on the content page, and under week 2, you are assigned to read chapters 1 through 4 in Skloot in our Immortal Life of Henrietta Lacks book, as well as the Conrad piece, Shifting Engines of Medicalization. I originally had this for y'all to read last week, which hopefully some of you did, but I wanted to make sure that everybody actually read it, so that's why I kept it for this week as well, and your quiz this week is going to be on that reading. Mainly, this Conrad piece, I think, gives us a really good sort of foundation or introduction into what medicalization even means, or maybe more so what sociologists mean when we're talking about medicalization. So if you click on week 2 here in our Blackboard, you'll notice a couple of things. Maybe if it works. Okay, here we are. So I'm going to have the reading outlines. Now, some weeks the reading outlines are just going to be putting PowerPoints up on Blackboard. This week I'm actually giving you a verbal outline through this video, so I'll post the video here. You also have the week 2 discussion post, which is going to be on those chapters 1 through 4 in the Skloot reading. And what I'm asking you to do this week is to just summarize the reading and provide 3 questions based on that reading. Remember, your discussion posts are due by Wednesday, and then by Friday I would like for you to comment in a thoughtful manner on a colleague's post as well. And then the other thing you have to do this week is your first quiz. So you can take this quiz at any point you want, starting tomorrow through the end of Friday. So you have until 11:59 p.m. on Friday. And the quiz is just 5 questions based on the Conrad reading, and you have 20 minutes to complete the 5 questions. So hopefully you feel like that's ample amount of time. And the questions are mixed format. So you have a couple true false, multiple choice, and then a few short answer questions. So just to kind of touch base about the Conrad reading and what's going on in there. So Conrad is giving us an overview as to what medicalization is, and also what sort of institutions or drivers of medicalization exist in society. So first off, just to make sure that we are all on the same page, the way that sociologists generally approach the topic of medicalization and also define it, sorry, I keep looking at my book, I just want to make sure I'm not messing this up for y'all. So anyway, medicalization became the definitional issue is defining a problem in medical terms, usually as an illness or disorder, or using a medical intervention to treat it. All right, so generally speaking, when we throw around this term medicalization, that's what we're talking about. And some things or diseases maybe have been medicalized for all of its history, but a lot of diseases and illnesses that we are super familiar with in our current times weren't necessarily always thought of as disease or illness or something that had to be dealt with in the medical institution. We can trace the legacy of mental health and society's various ways of dealing with people who have experienced mental health issues. Also, we can just talk about the general rubric or more so umbrella of what falls under mental health problems nowadays, right? I think a lot of the specific issues and diagnoses that we have now weren't even part of people's thoughts back, let's say, 50 years ago, 100 years ago. Even if we look further back than that, right? A lot of people who had mental health issues were possibly possessed, right? So we had religious explanations, not necessarily medical explanations. We also can trace things like the evolution of looking at behaviors that we thought were pathological, such as maybe alcoholism or even homosexuality, that used to have some sort of diagnosis or lack of diagnosis, and that has changed over time, right? So alcoholism, for example, was something that we thought was just, a person, yet again, maybe was possessed, or just that they couldn't really handle what life was throwing at them, right? And now it is a diagnosis. It's a disease. It's an illness. Conversely, we've also seen the retraction of an illness label. For a very long time, homosexuality was in the DSM, which is the main book that psychologists and psychiatrists use to diagnose people. And it wasn't until the 1970s that that was taken out as an illness or a diseased behavior. So these things are constantly fluctuating and constantly changing. And that is definitely one of the key things that the sociology of medicine is asking us to look at, right? Not take as necessarily a granted or a given that, birth has to happen in the hospital, or that doctors know the most about what is going on with a person's child, whatever it might be. And so we're really trying to take that step back and examine, how did whatever it is we're actually interested in become diagnosed or become labeled as something that has a diagnosis or is an illness or can be treated by medicine, and doesn't necessarily have to be that way? And is this the best way to approach such things? So going back to the Conrad reading, he gives us that definition of medicalization, and he also kind of talks a little bit about the history of the study of medicalization and how sociologists got interested in it and all those good things. Now, one of the things that I want to point out that he points out is that if one conducted a meta-analysis of the studies from the 70s and 80s, several social factors would predominate. At the risk of oversimplification, I suggest that 3 factors underlie most of the medicalization analysis that people did in the 70s and 80s. First off being the power and authority of the medical profession. Second being the medicalization sometimes occurred through the activities of social movements and interest groups. They talk about here about Alcoholics Anonymous. I'm also going to put out there that even the recognition of AIDS and the move to figure out a diagnosis came a lot from the social movements and activism that were spurred by predominantly those in the gay male community, but also the allies who pushed the medical industrial complex into understanding that this was a disease. And the third thing Conrad points out is that there were directed organizational or inter or intra-professional activities that pushed medicalization. So for example, the push for obstetricians and the demise of midwives, or the rise of behavioral pediatrics in the wake of the medical control of childhood disease. So starting to change the way we looked at these things also opened up avenues for new, not even industries, but new professions more specifically. Okay. Now, we've seen a huge change in medicalization, and this is what the crux of the Conrad article is actually about. By the 1980s, there are profound changes, and he argues, and this is something we can definitely debate, is that there was an erosion of medical authority, right? So doctors are no longer the only source of authority when it comes to medicalization, disease, and illness, right? Health policies shifted from concerns of access to cost control, and managed care became central. Another key change that came along here is large numbers of patients began to act more like consumers, right? Both in choosing health insurance policies and seeking out our medical services. Patients, or people, let's just say in general, are much more, by and large, well-versed in medical advancements and how we label or talk about disease. And they also are much more willing to engage critically with doctors about their decisions and their wishes for how they're going to move forward with any diagnosis. Ultimately, Conrad is focusing on these 3 key emergent engines of medicalization: biotechnology, consumers, and managed care. Now, with biotechnology, this has kind of always been around, but to a certain extent, the influence and also progress of biotechnology has exponentially changed in the last few decades. Now, he notes that whether it be technology such as forceps for childbirth, which, yes, are a form of technology, or drugs for distractible children, technology has often facilitated medicalization. These drugs or technologies were not the driving force in medicalization process, facilitating yes, but not primary. But he argues this is changing. The pharmaceutical and biotechnology industries are becoming major players in medicalization. So the first thing that he specifically looks at is pharmaceuticals, right? The pharmaceutical industry. And I think one of the key points that is super important here is the fact that starting in 1997, pharmaceutical industries and companies were allowed to specifically advertise to patients and to consumers. They can now advertise directly to the public and create markets for their products. Overall, pharmaceutical industry spending on television advertising increased sixfold between 1996 and 2000 to $2.5 billion, and it's been rising steadily since. And I want to point out that we are actually one of the only two countries, and sorry, by we I mean the United States, is one of the only two countries that advertising directly to consumers by pharmaceutical companies is allowed. It is not legal in most other countries. And so this is one of those institutional aspects of medicalization that a sociologist is going to critically examine. What does it mean to have drugs advertised directly to consumers, not to doctors? What does it mean that we have such a significant for-profit pharmaceutical industry? And what happens when we shift authority and knowledge to companies and from doctors? Now, this isn't to say that doctors know everything and that doctors were always right when they diagnosed us, but it's more to get us to expand who we understand as figures of authority in our healthcare systems. Okay, so biotechnology has inherently changed, right? One of those things being the pharmaceutical companies. Also, just sticking on this for a second, you should start watching those commercials through the lens of what we're going to be learning about this semester. It's super fascinating. I love commercials, specifically drug commercials. Now, the other aspect of biomedicalization that Conrad highlights is the role of genetics and enhancement, right? So the Human Genome Project began in earnest, and a draft of it was completed in 2000. A lot of times what people are looking for is kind of that one gene or the series of genes that's going to allow a disease or an illness to just be taken care of or to go away. Now, of course, I think a lot of this is still more goal-oriented than actual practice, although we do see the use of some gene therapies. Conrad points out, I think, the use of human growth hormone, and we also have a really advanced in pre-genetic testing for embryos, etc. So this has come into play, but maybe not just to the extent that people thought yet, but it's definitely the future of medicine. Okay, so we have biotechnology, we also have consumers, right? In our changing medical system, consumers of healthcare have become major players. So as health has become more commodified and subject to market forces, medical care has become more like other products and services. We are now consumers in choosing health insurance plans, purchasing healthcare in the marketplace, and selecting institutions of care. So this is one of those areas that is super fascinating for me personally, but I would also argue for a lot of sociologists. What does it mean when we commodify services related to healthcare and to illness and disease? What does that mean for society at large? What does that mean for the individual? And Conrad here goes into a couple of examples about how consumers have become a major factor in medicalization. And I think the most obvious one, of course, that he points out is the rise of cosmetic surgery, right? Elective surgeries for most people. not all of it is elective. Procedures from tummy tucks to lipo to nose jobs to breast augmentation have become a big medical business. Where does he talk about the money? Sorry. Overall, 8.3 million Americans had cosmetic medical procedures in 2003, a 20% rise from the previous year, and a whopping 277% rise since 1997. So it's definitely becoming more normalized. Other things that he points out as becoming more normalized are ADHD diagnoses, not even just for children, but of course this advent or introduction of the notion of adult ADHD, and also yet again the use of HGH. And the third prong that he talks about is managed care. So over the past 2 decades, he says organizations of managed care organizations have come to dominate the healthcare industry. And managed care requires pre-approvals for medical treatments and sets limits on some types of care. And to a degree, managed care has commercialized medicine and encouraged medical care organizations and doctors to emphasize profit over patient care. Now, he goes into the way that managed care has shaped our healthcare industry, even just by looking at the things that they'll approve versus the things that they won't approve, right? I think they bring up the example of approving psychotropic medications over other types of potential interventions. And yet again, this isn't to say things are good or bad, but just then how does this affect the way that we think about health and healthcare, and as far as what the realities of that are like for the people in our society. He also goes into how healthcare companies deal with the people who are diagnosed as morbidly obese and whether they will receive gastric bypass or get funding for other types of interventions. So those are the 3 ways that Conrad is arguing medicalization has significantly changed. So we have biotechnology, the role of consumers, and managed care. Now we of course can debate this, right? Maybe there are other things that are driving medicalization as well that might be just as or possibly more significant. So he closes with talking about medicalization in the new millennium. All right, so the engines behind increasing medicalization are shifting from the medical profession, interprofessional and organizational contests, and social movements and interest groups to biotech, consumers, and managed care. Doctors are still gatekeepers for medical treatment, but their role has become more subordinate in the expansion or contraction of medicalization. In short, the engines of medicalization have proliferated and are now driven more by commercial and market interests than by professional claims makers. And I think this is important to remember or to think about. Are doctors sort of the know-all, end-all? And are they still the figures of authority that maybe they once were? And if they aren't, how has that changed and why has that changed? One more thing I just want to point out about this reading is Conrad has a couple nuggets embedded in there, kind of, especially at this last stage. He brings up how medicalization is gendered. I think we can also talk about how it's classed and raced, which I'm hoping that the Skloot book is already kind of bringing some of those questions into your head. So hopefully this has been a little helpful as far as targeting you to the key points of this reading that I think are important. And for those of you who tried to read or did read the McKinley reading, The Medical Measures and Decline of Mortality, the overall gist of that reading, well, first off, it was really complicated. I understand. And I think it's good for you to start to get used to reading pieces like this. But generally what those 2 authors are trying to argue is that we tend to, as a society, think that so much of the longer lifespans we have come from medicalization and the medical interventions and advances that we've had historically. And while these are very important, we'll definitely get to talking about vaccinations as also medical technology and all of that good stuff. But what this reading actually is trying to tell us is that medicalization hasn't really accounted for too much when it comes to the longevity of human beings, or the increased lifespan that we have, and that there's actually other social forces or other structural forces that are at play, such as improving sanitation in a living area. We know that actually has a lot to do with quality of life and how long people live. And what they're kind of trying to ask us to do is to think of, other than maybe throwing money at medicine or just putting medicine at this top of this hierarchy in society, that we brainstorm these other ways that we actually can make quality of life and length of life improve for people that aren't just about medicine. So I hope this was helpful, and if you have questions as you're going through the reading, please feel free to email me. You also can throw them on that discussion forum that I have created just for questions about the reading, and I will be sure to check and monitor that during the week. I hope you have a great week too, and I hope that you enjoy the information you're being exposed to, and I'll talk to you all soon.